Welcome back to Harmonize Your Life Conversations on Self-Care for Women of Color podcast with your host, Dr. Toni G. Alvarado. All right, we are closing out the month of January in this podcast episode. And unfortunately, we are still experiencing the ravages of COVID-19. There is so much conversation around the vaccines that we have for the virus. There's much hesitancy in our communities and in communities of color and other communities around the vaccine. And so we are going to have a conversation today, a serious conversation about the impact of COVID-19 on our communities and this whole have a real talk conversation on this vaccine, on the different vaccines that are out there, and why we have so much hesitancy around the vaccine. I have a wonderful guest who's going to be with us today, who's very qualified to help us in this conversation on this topic of COVID-19 and vaccine hesitancy. So we'll be right back with our conversation for this week, right after this. Okay, so I have with me today in the podcast studio Dr. Emily Haynes Cooper. She was born and reared in Chesapeake, Virginia. She earned a BS ED in health education from Virginia Polytechnic Institute and State University. She also earned an MS in biology from Old Dominion University. She graduated from VCU School of Medicine in 2006 with a combined Doctor of Medicine and Master in Health Administration degree. She completed her residency training at the Carolinas Healthcare Family Medicine Residency Program in Charlotte, North Carolina, where she served as chief resident. She also completed an administrative residency with the chief medical officer at Sinatra Healthcare in Norfolk, Virginia in 2005. After residency, Dr. Cooper moved back to the Tidewater area to be near her family and practice outpatient medicine in the Riverside Health System in Newport News and Centaura Healthcare in Chesapeake, Virginia. She never lost her desire to work with underserved populations and was recruited back to Carolina's Healthcare, now Atrium Health, to launch a new model of care in rural Anson County, North Carolina. After successfully getting this new model of care established, she was then recruited back to the Atrium Health Biddle Point to serve as medical director. This multidisciplinary clinic is home to 8 board-certified physicians, 9 residents in training, and many ancillary services. It is also the site of the first food pharmacy established to help impact the social determinants of health and underserved patients in the Atrium Health System community. She enjoys the opportunity to participate in training future family medicine physicians. Her clinical interests includes adolescent health, women's health, office procedures, and geriatrics. And she has many outside interests and lives in Charlotte suburb with her husband, Brian, and daughter, Dylan. She is also a proud member of my beloved Alpha Kappa Alpha Sorority Incorporated. And so I am so delighted to welcome to the podcast studio today my soror and our guest for today, Dr. Emily Cooper. Will you help me welcome Dr. Emily Cooper to our podcast audience? Welcome, Dr. Emily.
Thank you, Dr. Toni, and thank you so much for inviting me to participate in this podcast.
Thank you. You came highly recommended by a mutual friend and colleague, one of your medical colleagues and friend of mine, who happens to also be a member of my self-care network. And she also is on the faculty of my self-care retreat, Dr. Talaya Clark. She's also been a guest on the podcast. So we share that relationship. We share that friendship.
Yes, I heard about Aruba and I'm jealous. So, I'm going to have to start coming something.
Yes, come on now. Come on. We had a wonderful time in Aruba. And so we are seriously considering taking the retreat back to Aruba next year. So we'll keep you posted on where we're going. And you can join us. We go every year in January. Those of you that are listening, our self-care retreat, we kick the year off in self-care, wellness, and fitness and all of that. Just all things self-care, all things wellness, all things health, all things fitness, all things women, right? We do that in January every year. And Dr. Talaya is one of our beloved faculty members of that retreat. And so when I told her that I wanted to have a conversation about COVID-19 and vaccine, particularly focusing on the vaccines and the hesitancy around the vaccines, she said, I have just the right person for you. And so I'm grateful that you were available and that everything worked out for us to have this conversation on today. So let's talk. And I entitled today's conversation, Real Talk, COVID-19 and Vaccine Hesitancy, a real talk conversation about it. So
now you want me to be real, or just
I want you to be real.
Okay.
Real. Okay? As real as you want to be, Doc. I mean, give us the truth. I know some people can't handle the truth, but we need it.
That part, they cannot.
Okay, we need it. Okay, so this the pandemic has taken many lives. The COVID-19 pandemic has taken many lives, and it's altered the way we do everything. I mean, everything. You were talking about us going to Aruba. Can I tell you, it was getting to Aruba. We were having, to take tests to get on to go there. We had to take tests, and unfortunately, some of my women did not get their tests back in time,
right,
to go. Then then we had to test to come back to the U.S. So there was the concern of whether or not we would have to stay over there in quarantine. Thanks be to God, no one had to stay there. None of us tested positive going. Of course, we wouldn't have been able to go if we tested positive going.
Right.
And nobody tested positive coming back. Thanks be to God. But just it's altered the way we travel. It's altered our church services. I'm a pastor. So it's altered the way we do worship experiences, the way we do funerals, the way we do. I remember last year, I was interviewed by NPR. They wanted to talk to pastors in Georgia around the show on NPR Here and Now. And so I was one of their guests last year, early in the pandemic in 2020. So it was actually in 2020 when I was interviewed now. And early in the pandemic, and they interviewed me as a Christian pastor. They interviewed a Jewish rabbi. They interviewed a Muslim, an imam. And they were talking, the title of the conversation was about the way COVID-19 has impacted the faith community.
Right.
And so maybe that wasn't Here and Now. Maybe that was another interview. I did another interview with Here and Now. No, the one I did on Here and Now was on voter suppression in Georgia.
Oh, okay.
That's a whole nother conversation.
Whole nother conversation.
That's a whole nother conversation. That COVID has impacted as well.
Yes.
But right. Yes, in the way we vote and all of that.
Right.
So but no, I think it was a local Channel 11 here in Atlanta, a local station that interviewed us, and the conversation was on the way the pandemic has impacted the faith community, and I talked about as a pastor how difficult it was for us to have to do graveside funerals.
Yeah.
And not, and in our culture, in African American church culture, our funerals are part of our sacred, rites of passage. You know what I'm saying? And not only do we, we have the wake, then we have the funeral service, and then we have the repast where the families get together afterward and eat and fellowship. And it can be like a family reunion for a lot of us, because sometimes, unfortunately, we don't even get to see.
That's when you see your family. That's right.
Until a funeral, unfortunately. And so in having, just as a pastor, then of course, moving our worship services to mainly live stream.
Right.
And very few, we just went back to in-person worship with very few people in the sanctuary, still not our full congregation gathering. All of our gatherings have changed. Travel has changed. How we do holidays with our family members have changed because of COVID-19, right?
Yes. So
talk to us. Why is the COVID-19 virus so different than maybe some of the other viruses? Because now I'm 58 years old and I've lived through other, I don't know if maybe not pandemics, but epidemics.
Like H1N1 back in 2010.
I remember when the swine flu was out, and the bird flu, and all of that. And so, but I don't remember any of those things impacting us like COVID-19. Can you talk to us about why is this one so different?
Yeah, and that's a great question. First, I heard I was getting some feedback. Can you hear me okay? I kind of changed my speaker.
You're doing better.
Good. So the big thing, the way I like to help people understand the difference, if you look at viruses on a continuum, right? So, you have millions of cold viruses on this end, and cold viruses can make you feel bad. They can give you the cough. They can give you a little bit of the fever, right? So then as we move along the continuum, flu would be next. And, flu, I tell people, if it's the flu, you are down for the count, 7 to 10 days. Most people will say the flu would feel like a Mack truck hit them. Now, cold viruses usually don't go down into your lungs. They're going to stay your upper airways. So most cold viruses just kind of, your throat gets scratchy. You may have some cough, but, you can bring up mucus. The flu virus, while it can also mostly work in your upper airways, there are times that the flu viruses go down in our lungs and can cause a secondary pneumonia.
Right.
The difference is the COVID virus is primarily a lower lung type of virus.
Okay.
So yes, it can cause some of those upper airway systems, but where it really kind of gets in and causes a lot of trouble is down in that your lungs, your bronchioles, all of those small parts. When you see a picture of a lung and it looks like a tree, that's where COVID works and can cause a lot of problems.
Okay.
So it's, if you think about the continuum, your cold is, your, okay, I might feel bad. The flu is, okay, yeah, I definitely feel this. And it takes me a while to recover. And then COVID, even within COVID, some people were asymptomatic or had mild symptoms, but COVID really has the potential, as we saw, to cause a lot of problems. Okay. And I think you may recall that people talked about, even President Obama said, we have to really prepare for a true pandemic.
Yeah, so I remember that. He said that when he was, I think it was like shortly after he took office.
Yes,
I
yes.
remember
And a
that.
true pandemic is where we are, where it is truly affecting the entire earth. So, pan is everything. So it's affecting everybody across the globe. And that's really where we are. And we were grossly unprepared, as you know. We won't even get into the politics, but
Okay.
it really showed us how quickly something could spread. Because they talked about, oh, okay, there might have been one person that came in and we're going to stop
Yeah, I
travel from
remember that.
China. And
Yeah,
then next thing you know, it's like this thing is everywhere.
yeah.
And it literally is and still is. 2 years later, I'm with you. I'm like, Lord, please.
Yeah, I'm like, God, can you please? This is a plague.
Yes.
This is like
Yes.
a Bible plague. I'm telling you,
Yes.
it's just and it's so it can be so discouraging. I remember when we
Mhm.
were in 2020. I remember in January 2020, um,
Mhm.
my husband went to Chicago and he came home with a cold,
Mhm.
but it seemed like it lingered longer. And
Mhm.
but we were like, okay, it's just a cold,
It's a cold, right?
but it seemed like it took him forever to get over that one.
Right.
And then I remember I went to Portland, Oregon in
Mhm.
February 2020. I had gone to Portland, Oregon, and that's when you started hearing that there was this virus in China. You started
Right.
hearing about it like the end of January that year.
Mhm.
And then I
Mhm.
flew like early February to Portland, Oregon to minister for a conference. And I remember hearing the conversation on the news, the CNN, and were reporting about this virus that was in China, or whatever. By the time I got back, I was gone for like 4 or 5 days to Portland, Oregon. By the time I got back, they were saying, there was a case in the US, and then by the
Mhm.
and it was only one case, it was isolated. And then all of a sudden, you start hearing it was more cases and
More
more
cases.
cases. And then
Mhm.
they started just showing the numbers. And by March,
Yeah,
we
it
were
was.
shut down. We were shutting down
Yes.
because
Yes.
it was like the numbers just quadrupled.
Yeah.
I mean,
Mhm.
overnight.
Mhm. Mhm. And that's what happens because at that time, we were just really starting to figure out, okay, we need to have, processes, we need to have tests to detect. So, I'll tell people, they'll say, well, similar story to your husband, well, this happened in January or even this happened in December. You think it could have been COVID? And I'm like, it could have been, but of course, we didn't have the testing then. So we might have been calling those things flu, just because it looked like flu, it kind of acted like flu at that point that we knew of. So
Yeah,
it
and
just,
my husband even said to me, he said, "Man, I don't know. I think I might have already had it
mhm,
because I mean that cold that was a strange occurrence
yes,
for him. First of all, to be sick because he doesn't
hmm
really get sick, and then it took so long for him to get over it. And I remember
right,
the cough was real deep,
hmm
but he ended up getting over it. So without he didn't have to go to the hospital or anything. So
right,
eventually he
right,
just got over it. But I know several people who have said that they think that they had it
had it,
before. Several people say, I think I already had this because I remember I got really sick around that time or whatever.
right, right,
Yeah. So, I mean, now there's so much misinformation,
yes,
so much
yes,
misinformation about COVID-19, about
hmm
vaccines that seem to be, to me, elongating our time
yes, agreed.
in this pandemic. And one of the reasons, I'm going to say this parenthetically, and then I want you to speak to that. One of the reasons that in this podcast, one of the things that I encourage those who listen and watch this podcast to do is to subscribe and share it. And I tell them, if when you subscribe to my podcast, those of you that are listening, the reason that we do this, and I ask you to subscribe to the podcast and share it, is because when you subscribe to my YouTube channel, particularly when you
hmm
subscribe to my YouTube channel, it causes the our algorithm with this podcast will the more people that are tuning into this podcast via YouTube, then when we go to the Google search engines and stuff, this
Right.
podcast will come up as a
Right.
recommendation.
Right.
And
Mm-hmm.
I ask people to subscribe to the podcast because the internet is so full of misinformation, erroneous information, negative
Yes.
information, and really information that's killing people.
Yes.
And so, and I encourage my listeners to share this podcast and to subscribe to our YouTube channel so
Mm-hmm.
that more information like this, and we
Yes.
can have more people like you, Dr. Emily, out here giving information, correct information that can
Mm-hmm.
educate our community and help people, because the conspiracy theories and the misinformation and all the stuff that's out there, it's amazing to me
Yes.
how intelligent people can buy into some of those
Mm-hmm.
theories. But,
Mm-hmm.
but what are some myths that we need to dispel, in your estimation, when we're talking about COVID-19 and about viruses, about COVID-19
Mm-hmm.
in particular, and even about vaccines in general? What is some misinformation or myths
Mm-hmm.
out there that we need to, in our conversations around the dinner table, around family? I
Right.
was in the grocery store earlier today, and I was standing with in the line, and there was a gentleman behind me, older white gentleman behind me, and he was actually in a one of those motorized chairs.
Mm-hmm.
Um, and and he had a trach, and he didn't have on a mask, and he was talking about, he was just spewing misinformation. I mean, he's in a motorized chair. He's got a trach. Now,
Got
this
a tray.
day,
Mm-hmm.
no mask. And so he's talking to us, some of the people in the line. I had to tune him out because I was like, Lord, please help me.
Right.
Um, and then another gentleman that was in the line with us, he said, my father's the same way. He's like, he's one of those anti-maskers,
Yep.
anti-vaxxers,
Baxter.
and he's like, you just cannot tell him anything about it. So,
Mm-hmm.
so even in our, we're doing this on the podcast, but we're having conversations around the dinner table,
Right.
at family gatherings, at church.
Agreed.
What kind of
Mm-hmm.
information and myths do we need to be concerned about, and how can we dispel those?
Yeah, that is a great question. And the best thing that my husband always says that he tells people is, Google is just a search engine. So it doesn't matter what comes to the top of your search. It's all in, who may have paid for that search to come to the top, or that information. So I just wanted to put that out there when you were kind of leading me to the question. So the way I typically answer this question is, I like for people to tell me, when they come into my office, I will say, what are some of the questions you have for me? But,
Mhm.
some of the myths, number one, as far as the spread of COVID, let's talk about the mask. That there was, oh, with the mask, you can't breathe. And, oh, if you have asthma or other breathing issues, you shouldn't wear masks. And, oh, you're breathing back in CO2. So none of that is true. Yes, are the masks uncomfortable? Certainly. Um, is it I think most of these people are breathing their own bad breath back in, but anyway. We said I could be real, but
Be real.
so
This is
that's the
real
first
talk.
thing. That-
COVID-19 and
Real
vaccine
talk.
hesitancy. Be real.
Real talk. So, what I tell people about masks, remember, there's nothing out here, nothing that will 100% prevent you from potentially getting COVID. Okay. The
Mhm.
mask will help decrease your risk, especially if, I'm coming in time. If you and I were sitting in the same room, we
Mhm.
would be in masks, right?
Right.
Because my mask protects you, your
And
mask protects me. So
exactly.
that's number one.
Say that
You
again.
know,
My mask protects you,
you,
and
your
your
mask
protects.
protects me. That's right. Because
Right.
if you think about it, if you're coughing or sneezing and it's going in your mask, then it's not, those particles are not floating in the air and hitting
Mhm.
me. or
Mm-hmm.
fewer particles are, right?
Uh-huh. Uh-huh.
So that's the first thing, because that's the number one thing that people want to say. Masks don't make a difference. They don't matter. They don't protect you. They do. The problem is when you have that person who's trying to say, "Oh, it's 100%." There's nothing that's 100%.
Nothing is
Okay.
100%. Exactly.
So that's one myth that I like to try to dispel with people about the mask.
That's that
Um,
all or nothing mentality.
Yes,
That
because if it
all
doesn't work all the way, it doesn't work at all. And
right, right.
that's not true. And that's
Mm-hmm.
the same thing with the vaccine. People
Mm-hmm.
say, well, what's the point in getting the vaccine if you can still get it? Well, what we have absolutely seen, especially with Omicron, is that people who are vaccinated and boosted, that their time of their illness is less. Um, they will have their illness is not as severe.
Okay.
You still have folks who may be immunocompromised, elderly adults who have other medical problems that they can still have hospitalization and serious illness. But for the most part, if you're vaccinated and boosted, that if you come across Omicron, your illness is not going to be as severe. And honestly, I was a witness of that with my sister, who is a breast cancer survivor. She has multiple medical problems. She told me she had COVID. I immediately prayed, but still, in 2 days, she was feeling much better. And we
Okay.
just did not see that prior to the vaccine coming
Yeah.
along. It
Yeah.
was, if you got COVID, you pray, and hopefully you're one of the ones that does okay, right? So yes, we know the vaccines make a difference. We know the mask make a difference in transmission of the virus,
Okay.
because there's nothing that's 100%, and that's two myths right off the bat, that but people don't want to hear that. Like you said, it's the all or nothing. Another myth is that you're getting live virus with the vaccine. You are
Okay.
not getting a live virus.
Okay.
We've all seen that picture of the vaccines where it has like the little spikes coming off of the little ball,
Okay.
that picture of COVID-19. So, what they did, now the science is not new, right? This mRNA, they've been researching this for decades, and this was the opportunity to put all of that work. So, it's that whole preparation meets opportunity, right?
Right.
So
Right.
they were preparing and doing the research.
Right.
COVID-19 gave the opportunity to use this research.
Okay.
So your mRNA is like your transcriptionist, right?
Mm-hmm.
So, the information is given to this transcriptionist and she just spits it out. He or she, let's not
Okay.
be gender specific. So when you have the spikes of the protein, what they did was they put the spikes in the information for the spikes in the vaccine,
Mm-hmm.
sent it to put it in mRNA, so that when it meets your cell says, hey, that's a foreign object. We need to make the antibody to fight it. And
Okay.
so it creates the antibody against that spike. It destroys the spike, it's gone. So
Okay.
ain't no microchip in the vaccine, ain't no magnets in the vaccine. I haven't grown extra ears. I've had 3
And the
vaccines. I
government
grew
is not
extra
keeping
ears.
up with you through the vaccine.
That ain't nobody tracking you. You know how they tracking you is your cell
No,
phone.
they don't say anything about that. They'll say, I haven't heard, because with your cell phone, you can be talking about something, and the next thing you know, you got
You got,
advertisements and all
yes,
that stuff. And so they're listening and they're watching and all, but you
yes.
don't hear about that tracking, right?
That's right. That's
Government
right.
tracking me through a shot. Okay.
Mm-hmm. And you go ahead and make some little threat or use the BOMB word, and you think the feds ain't gonna come knocking on your door after you talking on the cell phone.
Wow.
But anyway,
Wow.
them yo folks, Dr.
And
Toni.
here's the other one that gets me though, Dr. Emily. Now I'm just gonna say this. I got
Yeah,
to say this. This real talk, right? I gotta say
yeah.
it. I don't understand. I don't understand people who say stuff like, I ain't gonna take that vaccine because you don't know what's in it. But you go to Popeye's chicken,
Say that.
McDonald's, you go to restaurants, what of
Mm-hmm.
any sort. You don't know what is in that,
At all.
but you eat it.
Eating it.
I mean, you stand in line for it.
You don't know what's in Tylenol, but you take it. Or Advil or Motrin, pick your pain reliever. You don't know what's in that, but you taking it.
And I'm not saying, and here's my thing. I have friends who do not do vaccines, and
Mm-hmm.
it's okay. We have a couple in our church who they don't do vaccines, but they're
Mm-hmm.
very health conscious. They
Mm-hmm.
do a lot of supplements.
Mm-hmm.
They are vegetarians. They're extremely health conscious kind of people. You know what I'm saying?
Right.
So I'm not, this show is not to push the vaccine on anyone. I just
Absolutely
want to
not.
have the conversation about the
Right.
hesitancy and why there is hesitancy and what we
Mm-hmm.
do to help those, because there are those of us who need it,
Mm-hmm.
right? And I
Yeah.
don't want people who really need to take the vaccine to not take it based on some
Based
misinformation
on
or
misinformation.
something out there that just is not true.
Right.
That's just not.
Right.
So and like I said, I know I got friends who are very health conscious that don't take the vaccine. They don't believe in vaccines or whatever. They don't
Mm-hmm.
take the vaccine, not just the COVID vaccine. They don't take flu shots, stuff like that. Okay, fine.
Mm-hmm.
All right. But and I feel like it's a personal choice
Mm-hmm. It
in
is.
that sense. However, I just think that if you're going to not take the vaccine, have a um educated, informed opinion.
Mm-hmm. Yes.
That's what I'm trying to say.
Yes. And what cousin Pookie or Ray Ray or them down the street said is not informed, because that's the other thing. Well, so and so told me this, or so and so told me that. And typically, my question, I'm a different type of doctor. So usually my question is, well, what medical school did they go to? Or did they do research? Are they a researcher? They got a PhD? And often they just
You
look at
sound
me
like my
like,
husband. You sound like my husband.
so,
my,
I'm a different type.
my husband says sometimes, so you think your Google search is
Hmm.
tantamount to my years of studying and preparation, my THM, my DMin. You think that your little Google search is tantamount to that?
Exactly.
Okay, all
Yeah.
right.
Yeah. Yeah.
But,
Exactly.
now what's really interesting though about it is, growing up, we had to be vaccinated to go to school.
Mhm,
Measles, I remember.
mhm,
My children, I had, to
mhm.
get them in school, we had to be vaccinated. My daughter,
Right.
even today, at she's in grad school at Ohio State, and before she left this summer, she had to send her immunization records over. So
Yes.
so we had to have vaccines for school, measles, chicken
Mhm.
pox. I travel, so I have to. When I went to Africa and places like that, I had to
That's
take
right. You had to get your travel vaccines. That's right.
travel vaccines, and I even had
Mhm.
malaria pills to go to
Right.
Kenya and things
Mhm.
like that. So why does there seem to be a rise in vaccine hesitancy today? It seemed like to me it's a little more. I don't know. Maybe it's always been there in our
Mhm.
community, but for some reason it seems heightened to me.
And this is my opinion, of course. Is I call it the Jenny McCarthy effect. When there was the talk of, this vaccine causes autism and this vaccine causes autism, even no matter how much we pulled out study after study after study that found no correlation, then it just kind of took hold. And even though now more people are like, okay, yeah, I get it. I think it was MMR, maybe MMR vaccine doesn't cause autism, but then it just opened the door. So now, people are showing videos, and this is what happened to, my child after they took this vaccine, or this is what happened. And, people see that now. We're in more of a digital age, right? So
Okay.
it's easier to post
Information is
that video. The information is there
mis-
without
and
being able to have the backdrop.
the information and the
Yes.
misinformation is more readily accessible.
Correct.
Ah,
And it pulls more at your heartstrings when you see this young teenager who was perfectly fine last week, and according to the parent now, 2 months after this shot, this has happened. So you add that in, and then more mistrust of healthcare and doctors in general. Like, I feel like it's worse now than when I became a doctor, where people just don't trust, the information, that the things that we share, right? They want to question this, or, well, I'm a free thinker, and, I'm going to look it up for myself. But again, when you're doing a Google search, it is simply a search engine. So depending on how you type things in, when you're looking for things, you type in a certain way,
yeah.
it, it will vary what's going to pop up.
Yeah.
So that's what I say. It
What
was
you want to read and what you want to hear too.
exactly,
You
exactly
know what you
based on what you decide you want to believe. And then if you of course find another group that's similar thinking to you, okay, yeah, they think similar to I do, so this is the way to go.
wow.
So I really think it didn't start with COVID. It started and has just this is the result. So
I know you don't want to talk political, but I think we should.
yeah, that's
Real talk. So, do you think
fine.
that the politi- um, politicization
Hmm.
of COVID with the Trump administration, do you think that that had any impact on where we are?
I absolutely do because you had someone who, oh, is not real and it's the Chinese virus and put the bleach in your arm. All of the foolishness that was put out there, not the blatant mistrust of the people you had standing with you trying to educate Dr. Fauci and the other folks from the CDC. That on top of, with science, the way we learn in science, right? You do an experiment, it may not work, but you'll learn, well, this is really what you should do to make it work, but you'll also learn, well, this is what doesn't make it work. So with science, it's always a question, you know, is this the way that the COVID vaccine is spread? Is this really where it came from? So you combine the political side with people not really understanding science because yes, things change. We all know that the information changed, but that's because we learned more about it. So we learned about it as it was evolving. We're still learning, right? Because even though we're 2 years into this, we still don't know those folks who had COVID in 2020 and survived. Are there going to be any late effects in 2025, right? So
Oh,
we're still learning, but people, they just see, oh, okay, well, the CDC changed this or they changed that. It must be a lie. No, that's called science and the scientific process. So when you had the politics playing such a big role and all the drama that he created, so you have a lot of his followers who are like, I'm not getting vaccinated, I'm not doing this, and you're seeing it all the time that they're dropping like flies with COVID. And on the backside, Republicans who, supported him in public, oh, they were going to getting those vaccines in private. They were going to getting the treatment just like he did when he got it. So
exactly.
you're saying one thing and doing another, but
No,
people don't want to point that out.
yep.
So
And people die listening to that.
yes, and still dying.
Yep. Yep. Die listening
Hmm.
to that and following that. So you talk about the mask, wearing the mask, anti-maskers, and all of that. You
Hmm.
said that wearing a mask does not prevent us from catching, but it does help mitigate,
It decreases transmission.
decreases the transmission. And
Especially when you wear it over your nose. That's the other
okay,
thing that
I
drives
was
me
going to say,
crazy.
talk a
Wearing
little
it
bit
here.
more about that. Talk a little more about that.
Yes. So, the droplets. So think about when you sneeze and cough, right?
Mhm.
That most of those droplets that you expel come out of your mouth. But
Okay.
there are some, that come out your nose, especially if you have a lot of mucus, and little kids. We'll put it on little kids because, thinking about it as an adult is kind of gross. Your child sneezes or coughs, the mucus comes out of their nose.
Right.
So it's the same thing. If you're sneezing and coughing, your mask is down. Yes, your mouth is covered, but you can still have droplets that spew out of your nose
Yeah.
that can fly.
Wow.
So wearing that mask above the nose, I mean, the nose to the chin, that's what I tell people. Pull it up. It's got to cover your nose and your mask. So that's how it decreases the transmission. Now, you can still have droplets that come out the side of your mask, the top of your mask,
Mhm.
and those things can still fly and hit people, but it's going to be much fewer than if you're not masked at all.
Okay.
So there's some videos and all that are completely disgusting, even for me as a doctor, where it shows, people sneezing and coughing, and it shows the droplets and how they spread. Yes. So we want that to go in their mask and then they can change their mask and put on a new one, but
Right.
we don't want that going in the air. And I think COVID just, and we all kind of, most of us, I should say, felt that, because you think about somebody sneezing or coughing behind you and you're just like, ew, icky. now with COVID, that's magnified because it's like,
Yeah,
oh my God, you
and
just gave me COVID.
and when you do sneeze or cough, you're like, you want to tell everybody, it ain't COVID.
It ain't COVID, right? You're like, I'm fine.
Right. I was at a meeting this week and I sat down and you know how sometimes, and I had on my mask, because sometimes with me, the mask makes my nose run.
Mm-hmm,
You know, if I have it on, I'll find that my nose runs from having the mask on. Of course, I keep it on, and then of course I blow my nose when I need to. But so I sneezed in this meeting, right? And first thing I thought was, Lord, these people gonna think I got COVID. I was like, I don't have COVID. I said, or even, but and in 2020 when it first hit, and this is not, I'm not laughing because it's funny because people really did. You mean it was the mental,
right?
I mean, listen. I have one of the shows I got coming up was going to be we're going to talk about pandemic PTSD, right? But just the mental, like I remember when in 2020 when we were really shut down, when we weren't going anywhere, and everybody was home, working from home, the world was shut down, and I remember like if you felt something, you would be thinking, oh Lord, is this COVID? Your mind would play tricks on you, or you would be breathing and trying to make sure you hold they say, well, hold your breath, and if you can hold your breath for so many minutes.
I forgot about that. Yeah.
I mean, and you just the mental stress of it all,
right?
Of just just wanting to make sure that you're not infected, or that you're not around anybody that's infected.
Right?
And then now with Omicron, the Omicron variant. So talk about the different variants. We had the Delta,
the original.
Okay, and then now we have this Omicron.
Right.
So we've had 3, right? Or 2?
We have had, actually we're further down the alphabet. I think these are the major ones that have really kind of come up and made themselves known, I would say.
Okay, so talk to us about those 3 that have made them.
Yeah. So the original, if you will, we know the transmissibility of that one was about 1 to, I want to say it was 1 to 3 or something
And
like
that's
that.
the one where everybody, but they was telling us you can't touch people.
Right.
It was transmitted through touch, all of that.
Right.
Yes. And we was wiping down our counters and
wiping down the milk jug. Girl, I was wiping everything.
Just how to
Yes. Yeah. I was the first one exposed in my clinic, actually. It was March of 2020. And I had just taken my parents back to Virginia, and the pandemic was really kind of starting to heat up, and I was actually going to AKA regional conference. So I took my parents home to Chesapeake and then went to Richmond for the conference. And my my roommate and I, who we crossed together in undergrad, we decided, okay, we probably are not comfortable staying. I hope they in the conference early, which they did. So come back to work. My office never closed at all during the pandemic. Some offices did. Ours was one that stayed open because we serve an underserved community. So we could not leave our patients hanging, right? Because they had nowhere else to go. Okay. So that next week, had a couple come in, and an older couple and a gentleman, had cut the grass, and he was like, well, I think I'm having symptoms. I cut the grass, and I'm like, well, let's test you. Sounds plausible that it's just allergies, but let's test you. He ended up with COVID. He was in the hospital for 2 months. So I'm sweating bullets for a week because I'm like, oh my goodness, I'm in the room with him, really not thinking it was COVID. I was masked and I had gloves on, but we really weren't doing the PPE yet. I mean, this was literally like March 15th, 16th of 2020. So, and he actually survived. He was in the hospital for about 6 weeks or so, and he survived and is doing well. But I just remember, being terrified. I slept downstairs in the basement because I didn't want to expose my husband and my then 4-year-old, so I'm like, well, we'll see what happens.
Mhm.
So anyway, the original was you could transmit it. It was about 1 to 3. We look at spread, how many when they can do contact tracing. If you have your patient 0, right, even though 0 is typically the original person, but you still look at kind of who gave you COVID, right?
Right.
So with the first one, contact tracing was a little bit easier because most folks could kind of link back to who had it. And that transmissibility was about 1 to 3. So then, we're all unvaccinated then. So COVID literally has a playground. That's what I call it. In the unvaccinated person, mutations will happen anyway. That's how we end up with millions of cold viruses.
Okay.
So COVID gets in an unvaccinated person, it mutates. That's just what COVID does.
Mhm.
And so the role of the vaccine was if we can get most people vaccinated, you hear about herd immunity,
Mhm.
then we cut down on how long COVID can hang out in the body and
Mhm.
mutate, right? Because the vaccine being cuts down on more severe illness. So
Mhm.
COVID doesn't have a lot of time to replicate, cause a lot of problems, mutate, because you make a bunch of copies, one of them is going to look funny. So
Okay.
think of that as your mutation. So then we get to Delta. So Delta comes along, and we have people who are vaccinated, starting to get more and more people vaccinated.
Mhm.
Still a lot of people unvaccinated.
Mhm.
So it still has a playground in which to hang
Mhm.
out longer and cause a lot of trouble and make a bunch of copies and have errors and end up with mutations. And Delta was more transmissible than the original. So with
Okay.
Delta, we were looking at one person could have potentially infected 6 people versus 1 to 3 with the original. Delta was much worse in people who were unvaccinated. So we had quite a few people, unfortunately, pass away who had COVID, much more severe illness, more people that you consider your long haulers. They're still
Mhm.
short of breath. They're
Mhm.
still really tired. People with heart disease now after having COVID, that sort of thing is what we saw with Delta. Along comes Omicron. Omicron is even more transmissible. They're still even trying to figure it out. They're thinking it's double what Delta. So if Delta was 1 to 6, they're thinking Omicron potentially is 1 to 10. You also have symptoms sooner. Your time that you're infected with Omicron, if you remember, just to put a pin in that, to go back to the original, we said, okay, if you were exposed, you got to wait, up to 14 days is
10 days.
if you
Right.
have symptoms.
Right.
With Delta, people typically had symptoms within about 7 to 10 days.
Right.
Omicron is 2 to 5. So you're going to have symptoms by day 2 after being exposed. So it's spreading much more quickly. Omicron is everywhere, everywhere. People, it feels like a cold for a lot of people, especially if they're vaccinated. It still is wreaking a lot of havoc on the unvaccinated, like Omicron and Delta, both in unvaccinated individuals, is really causing very severe illness. Our ERs are overrun. People complain they've been sitting in the ER for hours.
Yeah.
Our ICUs are full again, just like it was in the beginning. So Omicron and Delta are really almost the COVID and the unvaccinated. Like it's like your vaccine came, Delta and Omicron are really wreaking havoc in unvaccinated people.
Wow. Wow.
Mm-hmm.
Can you talk to us about maybe I know that one of the things that the COVID virus did, particularly in communities of color, they were
Mm-hmm.
it was hard on us because of other pre-existing conditions like diabetes, high blood pressure, high
Mm-hmm.
cholesterol. And one of my messages on self-care, health, and wellness is preventative care is always better
Yes.
than this kind of maintaining care or
Right.
maintenance or
Right. Mm-hmm.
health care is better
It's better. Right.
than
It's
sick.
focused on prevention versus treating conditions.
Yeah, yeah.
Yes.
So how can you talk to us about the importance of staying healthy so that
Mm-hmm.
you do get a virus like COVID-19? That how does a healthy body,
Yeah.
maybe, of course we know that ultimately it's God that keeps us healthy. We have to do our part. I teach my people we have to
Absolutely.
do our part. So can you
Absolutely.
talk to us about the importance of how should a healthy body respond? Because like you said, there's nothing that will say because I'm healthy that I won't get the virus.
Right.
But what are my chances of beating or overcoming or living beyond the virus without long-term heart effects on me if I'm already healthy and continuing to take care of myself with, eating right, exercise,
Hmm.
all those
Hmm.
water.
Those things play a big role just because if your body's not already fighting something like diabetes and blood pressure and even obesity, we know that that's a primary um, factor that leads to poor outcomes.
Okay.
So, if you're focused on being healthy, eating properly, exercising, controlling your weight, that
Mhm.
makes a big difference. What we don't know, and I can't really say at this point, is if you are healthy and you do survive COVID, because we've had, young people and all who were healthy who unfortunately didn't, that means you won't necessarily have the long-term effects because that goes back to we're
Okay.
still in the middle of this, still learning.
Okay.
But certainly if you come into it healthy with very few medical problems, no medications, your chances are much better than someone who's on multiple medications, is overweight, and we know that that's a big difference. So I tell people, yes, let's be healthy. Let's start, wear the mask, stay 6 feet away, you know, support your local restaurant, but get your food to go. Don't sit in the restaurant if you can afford it, especially some of the local places that you want to support that may have a smaller dining room, right? Because you're bound to be within 6 feet of someone you don't know.
Mhm.
So being really smart just about how you function in daily life. If you have a supervisor that that person likes to take their mask off in their office, like the only reason I'm sitting in my office with my mask off is because I'm on this podcast. We
And
keep our masks on
and
all day.
you're by
Right.
yourself right now. Mhm.
Right. So, if I'm going to take my mask off, I close my office door because if I leave it open, I have my mask off and somebody comes in to talk to me. By the time I get my mask on, I put
Okay.
them at risk
Right.
potentially. Right.
I hear you.
So, that's how I would say use your health, but you still have to use wisdom. And
Okay.
that's what my pastor says a lot. God gave us wisdom. So let's
Right.
wear the mask.
Yeah.
Let's stay 6 feet apart. Get your food to go in a restaurant. Don't sit there and eat. You can still support the restaurant. Get your food to go.
Okay.
So that's where I would put the focus as far as the
Okay.
health.
And what
Mhm.
about travel? Because we have some people who have allowed the vaccine to just keep them from doing anything. How
Mhm.
do you feel about that? I mean, along the same lines of what you're just saying in terms of travel and family gatherings and things of that nature. How should we conduct ourselves?
Well, I uh so I love to travel and I miss it very much. So, and actually, when you brought up funerals, my father passed in June of 2020. He did not have COVID, but like you said, we were not able to really celebrate him the
Mhm.
way we normally would have. And so we did actually, the church did not have a repast. They gave us money. We kind of got some food together, which was very nice because we weren't expecting that. But we had family come by and we kind of packaged their food. Those of us who packaged it, mask, gloves, apron, the whole thing. And that's how we did that. But everybody had to keep their mask on when they came to my mom's house and we wiped everything down.
Mhm.
So, what I would say about family gatherings is what we've learned, right, in this pandemic,
Mhm.
that the numbers have gone up after Thanksgiving, the numbers have gone up after Christmas. And so it makes it hard because, of course, the first year in 2020, people just kind of didn't get together at all.
Okay.
And then in 2021, it was like, well, I miss my family. I want to see them. And I absolutely get that because as we speak, my mother's on the way to my house to stay with us for
Oh,
a few weeks. But when this large family, you got to keep the mask on because you still
right.
don't know. All it takes is that one person, your cousin brings his girlfriend who, is doesn't realize that she's sick and it runs through the family. And that's what happens. They're like, well, it was just, this group of family or that group of family. But all it takes is that one person who's not yet having symptoms that they're aware of, or they're asymptomatic and they're carrying the virus and shedding it, meaning that they can infect others, and the whole family gets it. So I think it's just about being very, very careful, setting guidelines.
Yeah.
Now,
if you're gonna
Omicron,
wear your mask, don't take your mask off.
don't take your mask off.
Wear your mask, wipe stuff down,
Mhm.
Yeah.
And before Omicron, where tests were a little more available, then I would have said, okay, test a couple of days prior, but stay, don't go around other people. If you can already be off work, do that, because at least then you're not taking grandmama, the virus. But now, because there aren't many tests available, because Omicron is everywhere, we can't even really do that and just be like, okay, well, I'll test before I go. And even still, you might test before you go, because I have a colleague who tested before she went home for Christmas. She developed symptoms Christmas morning and she was positive. She was already at her mother's house. So it's hard, and I get it. You want to see your family, you want to be around them. You just have to really think about it, and who's coming and what are we doing. If you can't trust cousin to isolate before they come, they can't come.
Yeah. Yeah.
So
yeah.
It's tough. And as far as travel, we actually did go on a trip in November. We all prayed about it. It was just like, okay, it was a family trip to kind of, we took my mom to, almost like celebrate my dad's life, and my siblings, 2 of my 3 siblings went with their spouses. And, but we were in the Dominican and it was hot, but we had that mask on when we were out and about,
When we were in Aruba, we wore those masks. I've traveled throughout the pandemic. We took my mom passed away last year in May, and last year in this time last year, we were preparing to take her to Hawaii. We found out that her cancer had returned in January of 2021, and she wanted to go to Hawaii. That was something she wanted to do. And my sisters and I, we prayed about it. We talked, and mom wanted to go. We masked up, did what we had to do, and we took her to Hawaii. And that was our last vacation with our mom.
Yeah.
So, but we were, we did what we had to do. We were being very safe and careful as much as we could. And I've traveled several other times since then. In the pandemic, with my husband, by myself, with girlfriends, with family. But each time it's been, I'm not just out here, even when we went to Aruba, our group, we stayed with each other in terms of when we did things, we did stuff as a group. We didn't go out on excursions with other people that we didn't know. We didn't do that. We pretty much stayed in our area where we were, the resort, and they were extremely Aruba, over there it's required. Like over here, people talking about they're not gonna wear a mask. Not in Aruba. Everybody wears a mask. It's mandated.
Right.
And in some of these countries, other countries, they're better with it than we are.
They are.
They are. So, I told somebody you're probably more likely to get COVID in Atlanta than you are in Aruba, but
that part.
But Dr. Emily Cooper, I have kept you long enough. You have been so gracious, so gracious. You've given us so much to think about, so much information. And I appreciate that. You gave us real talk information. You gave us things that we can consider. Hopefully, those that are listening to this podcast, I do want to let y'all know where you can find us. If you're listening, this is Harmonize Your Life, Conversations on Self-Care for Women of Color with Dr. Toni Alvarado. This podcast you can find on Apple, on Anchor Podcasts, Apple Podcasts, Google Podcasts, Spotify, and the lightatl.live. internet radio. So I want to let you know that. You can also find us on my YouTube channel at Dr. Toni G. Alvarado. Dr. Toni G. Alvarado. And as I said earlier, if you're listening and you're not subscribed to my YouTube channel, please go to my YouTube channel and just subscribe. It doesn't cost you anything to subscribe. Share the podcast with others. This is a worthy conversation that maybe you may want to sit down with some friends and family and listen to this conversation that I'm having today, or that I've had today with Dr. Emily Cooper. I also want to encourage ladies to join. Those of you that are listening and watching, join the Harmonize Your Life Women's Self-Care Network. We started this network in 2020. It's almost 2 years. We're almost 2 years in June. It'll be 2 years since we started this network. And we have women from all over the country and even other parts of the world. We even have a sister in Germany that's a part of this self-care network. And so come on into this network with us. We have when you come into the network, you get invited to special events with me, like Tea Time with Dr. Toni, where I bring in guests and we have real conversations. We bring in people like Dr. Emily to come into those settings with us as well, where you're listening to the podcast, but in the Tea Time conversation, you actually get to talk with other women and presenters that we bring into that setting. And then there are other special things that we offer for the women who are a part of the Harmonize Your Life Women's Self-Care Network. Come on and be a part of this community. We are a community about wholeness, about holistic living, about self-care, health, wellness, fitness, and fun. We believe in having fun with our fitness as well. So come on into this network so we can support you in your self-care, health, and wellness journey. I also want to let you know that we are finishing up our fitness challenge. You still have time to join Dr. Toni's fitness challenge. We have them periodically throughout the year. I'll offer a challenge, a fitness challenge, and encourage women to get fit and exercise. While you're there on my website, go to my website at drtonialvarado.com and get and purchase our fitness apparel there. We have fitness apparel there that you can purchase on my website at drtonialvarado.com. Fitness pants, yoga pants, t-shirts, tanks. We even have sweatshirts. It's still winter time. We have sweatshirts, self-care, harmony, all those kind of things that you can be cute while you're walking in the park and working out. Our guest for today is Dr. Emily Cooper. She is a resident. She is a medical doctor there at Biddle Family Practice in Charlotte, North Carolina. You can look her up at atriumhealth.org. I'll put the name of her organization back up. It's Biddle Family Practice in Charlotte, North Carolina. Highly recommended by one of our very trusted voices on this podcast, a member of our self-care network, Dr. Talaya Clark. And so she recommended Dr. Emily, and I'm so grateful for this conversation that we have had. You can find her at the atriumhealth.org. Dr. Emily, thank you again for joining our conversation on Self-Care for Women of Color podcast with us today. Do you have any final word that you want to share with our audience before we go?
I just wanted to quickly thank you again for the invitation, and I'll thank Talaya for putting my name out there, and just want to, remind people just to take care of yourself. Be careful where you're getting your information from. And if you have questions, talk to your doctor. And I like to tell people whenever I've done these talks that if you feel that your doctor is not listening to you, or you don't like something your doctor has done or said, at least give your doctor the opportunity to address it before you just say, oh, I'm just going to leave. Because when we have patients that just leave and we have no idea what happened, it makes it difficult. So, we're human. We have a rough day as well. Give your doctor an opportunity and talk to them. Let them know your concerns. And if you still feel that they're not helping you or they're not listening to you, then go to somebody else. Because I want all patients who come to see me to know that this is a partnership. The physician, the patient, we're in a partnership. I can't work harder than you to take care of yourself. So just know that you do not have to stay with a doctor who you feel is not listening to you, but at least let them know and give them an opportunity to change. So I just wanted to leave you with that.
Good.
And it's been an absolute pleasure to be a part of this conversation today.
Well, thank you, Soror. I appreciate it. I appreciate you. And this will not be your last time on this podcast.
Yes, ma'am. I look forward to coming back.
Right? And then we got to get you at the retreat and all
Yes.
that stuff too. All right. Okay. Thank you again. We'll talk
Thank
real
you.
soon.
All right. Take care.
You too. Hi, this is Dr. Toni Alvarado, and I want to personally invite you to join the Harmonize Your Life Women's Self-Care Network. Join us for fitness motivation, health and wellness information, inspiration, self-care strategies, and ideas for creating harmony in your life. As a certified health and wellness coach, it is one of my greatest honors to support women in their fitness, health, wellness, and self-care goals. Join the Harmonize Your Life Women's Self-Care Network, and we will do you good on your journey.